Hi, I'm Dr. Jason Griffin. I'm an orthopedic surgeon with Tulsa Bone Joint. The reason I went into medicine and orthopedics is because of my father. My dad was an orthopedic surgeon who helped start Tulsa Bone Joint, and growing up as a kid, I got to spend a lot of time with him on the sidelines as he took care of football teams. Throughout my experience with him, I actually got to follow him even in the operating room, which was kind of cool as a young adult. Watching how he affected people and how his job affected people was really powerful to me. So being in the grocery store or being at a restaurant and having people come up and show their appreciation for how he had treated them and how he had got them back to their function, I thought, well, he must be pretty cool. He must have a really neat, important job, and that's something I should consider as I grow up. You know, as a kid, you usually idolize your father, and then as I grew up, I still idolized him and discovered that he was doing a really cool job that was important and meaningful. As I looked for a profession that was able to encompass those things, I'd never found anything quite like it. So a job where I get to use my hands and use my brain and make a meaningful impact in other people's lives, well, I never grew out of thinking that was pretty cool. My specialty within the practice is sports injuries and sports medicine, and specifically treatment of athletic injuries of all types, as well as specifically shoulder, knee, and elbow issues. The goals of our practice are to provide personalized, timely care with a bias towards conservative management, if at all possible, with utilization of novel or newer techniques when applicable. We try and invest in our patients and invest in their well-being and their outcomes. We try and be respectful of our patients' time. We try and do the right thing if at all possible, when at all possible, even when it's not the easy thing to do. And we try and guide our patients as if they are family or friends. We try and make sure that we make informed decision making where we share in the decision with our patients, and in doing so we tell them what options are available to them, explain the diagnosis and pathology, and help them to make a decision that not only makes medical sense, but makes sense for them and their particular position in life, makes sense for them in their jobs, and makes sense for them and their families. What I love about my job and my practice is taking care of people, is taking someone who's unable to do what they want to do with their lives at the current moment and get them back to doing that thing as well or better than they did before. That's probably why I chose sports orthopedics, is to have my athletes that have an injury that they think is season or career ending and get them back better than ever. We find a lot of personal pride and satisfaction in getting our people back to what they want to do, and that's probably the best part of my job.